President Donald Trump has accused the World Health Organization of mismanaging and covering up the spread of coronavirus after it emerged in China. He added that he would halt WHO funding while his administration reviewed the actions of the organization. While Trump's actions are seen as dangerous and short-sighted, it makes us wonder if he has a point about the WHO's response to the virus. This is a fact-check episode of Trump and his accusation. Before we get into the crux of the issue, we should know what does the WHO do. I did an episode about the WHO history, its functions, and about how China and WHO might have worked hand in hand to hide the pandemic in the initial stages. You can check that for detailed information, and now I'll give a short summary about the World Health Organization. It was set up in 1948 and is the part of the United Nations that is responsible for global public health, coordinating vaccination campaigns, health emergencies, and supporting countries with primary health care. Over the last 11 years, it has overseen the global response to 6 international health emergencies, including the Ebola outbreak in West Africa in 2014, the Zika outbreak in 2016, and right now the COVID-19 pandemic. The WHO also decides when to sound the global alarm during outbreaks. It sets up worldwide research and development plans aimed at fast-tracking new treatments and vaccines. It sends experts into the epicenters of disease in order to gather data on what works and what doesn't. But the WHO is an advisory-only body. It can make recommendations to countries on what to do to improve the health of its citizens and prevent the outbreak of disease, but it cannot enforce those recommendations. It is funded by fees and voluntary contributions from its 194 member states, and the US is the largest single contributor of WHO. US President Trump has accused the WHO of failing to challenge China's early assertion that there was no evidence of human-to-human transmission of the coronavirus. China first informed the WHO of a pneumonia of an unknown cause on 31st December 2019. On 5th Jan, the organization said the information it had from China at that time showed there was no evidence of significant human-to-human transmission. And on 14th January, WHO tweeted preliminary Chinese investigations had found no clear evidence of human-to-human transmission of the new virus. The same day, the Wuhan Health Commission said the possibility of limited human-to-human transmission could not be excluded, although the risk of sustained transmission was low. Around the same time, other WHO statements raised the possibility of some human-to-human transmission, referring to what was known about other coronaviruses such as severe acute respiratory syndrome, that is the SARS. On 22nd January, following a brief field visit, World Health Organization made a much clearer statement that human-to-human transmission was happening in Wuhan. Although it should be noted that a full delegation with international experts did not visit China until the second week of February. Then at the end of January, the WHO praised China for its efforts to contain the virus, including its commitment to transparency. Trump said there was credible information to suspect human-to-human transmission in December. He referred to a warning given by Taiwan experts to the World Health Organization about the virus. Taiwanese scientists had visited Wuhan shortly after the virus first emerged. But we should also note that the evidence published so far shows that Taiwan's exchanges with the WHO did not mention human-to-human transmission. Taiwan is seen as one of the few places in the world which has successfully stemmed the spread of the coronavirus without having the need to take big or mighty measures. The territory has also pointed out that it learned many lessons from managing its coronavirus outbreak, which could be shared with the world. But despite its efforts, it is still effectively locked out of membership in the World Health Organization as the territory is not recognized by the UN. It is also said that Taiwan is not recognized as a country still because of its complex relationship with China. What this means is that Taiwan has been excluded from emergency meetings and important global expert briefings on the coronavirus pandemic. Taiwanese officials also said that the island has been denied permission to attend the World Health Assembly's annual meetings in recent years. It also means the WHO lists Taiwan's coronavirus statistics together with China's data. The territory prides itself on having one of the best healthcare systems in the world, but not being a part of WHO has its own effects. The WHO says it has been sharing all information with Taiwanese health experts, but last month, after a senior official refused to discuss Taiwan's response to the outbreak, the WHO was accused of being influenced by China. The accusation was raised by Trump and various other world leaders. The World Health Organization has said in response that it will review its actions and that all its guidance was intended to limit human transmission. And although the WHO has been criticized for praising China's initial response to the virus, Trump himself praised the Chinese in a tweet on 24th January. However, Chinese officials did initially try to cover up the outbreak in Wuhan and silence those raising concerns. Independent Chinese journalists have detailed the Wuhan cover-up. They report that a Chinese lab isolated and identified the strange new virus last December, but the authorities ordered it to stop its work, get rid of its specimens, and keep quiet. When the late Dr. Lee tried to warn the public about the coronavirus, he was detained, charged with spreading false rumors, and accused of seriously disrupting social order. All discussion about the virus is censored in China. News reports indicate that delivery of funeral urns has spiked in Wuhan, whereas China admits to only 3,340 coronavirus fatalities nationwide. British Prime Minister Boris Johnson's scientific advisors have concluded that Xi Jinping's regime has downplayed the true number of cases in China by 15 to 40 times. Now coming back to US versus WHO, one important question that rises is that did the World Health Organization misadvise on travel bans? Trump said that the WHO had misadvised on this front when the US banned travel from China and other countries. The WHO has never directly criticized the approach of US, and also it is up to national governments to implement border or travel restrictions. But the global body did publish initial advice on 10th January recommending no international restrictions and repeated this the same day it declared a public health emergency in late January. The WHO has said, and I quote, restricting the movement of people and goods during public health emergencies is ineffective in most situations. But this advice was eventually ignored by most countries, including the US, where Trump had stopped all foreign nationals who had been in China in the 14 days prior from entering the US from February 2nd. Trump also said this reduced the spread in the US. So, to summarize, as US and China had their share of blame game regarding the pandemic, WHO was accused of being the handmaid of China and helped it to mask the real effect the virus would have on the world economy and population. The US president said funding for the World Health Organization would be on hold for 60 to 90 days pending a review of the WHO's warnings about the coronavirus and China. He accused the global body of severely mismanaging and covering up the threat. Critics were stunned at the move to cut money from a critical UN agency during a global pandemic. The UN Secretary General declared now was not the time to reduce the resources for the operations of the World Health Organization or any other humanitarian organization in the fight against the virus. Trump said that with the outbreak of the COVID-19 pandemic, there is deep concerns whether America's generosity has been put to the best use possible, as WHO failed to adequately obtain, vet and share information in a timely and transparent fashion. Trump himself is facing criticism of how he has dealt with the outbreak in the US, which now has more than 600,000 cases and 26,000 deaths. He also has a bigger geopolitical fight with China, which started long before COVID-19. However, the US leader is certainly not the first to criticize the WHO for its praise of China's response to the outbreak. It is also true that Without a WHO with a financial strength, there will be many more deaths. America contributed more than $400 million to the WHO last year, making it the biggest donor. The organization's budget for 2018 to 2019 was around $6 billion. The US is the biggest single donor to the WHO, which relies on a combination of members' fees based on wealth and population and voluntary contributions. These voluntary donations make up most of the agency's $2.2 billion annual budget. So, we see that US is a very important contributor and WHO needs US now more than ever to fight against the virus. That is all from me today. Thank you for watching. Stay connected with us. This is Nisha PS.